Hello, my name is ABienvenu, and today we're going to talk about intravenous therapy. First off, we're going to talk about the tubing and the fluids and how it gets to the patient. So we have a bag of normal saline here, 500 milliliters. Let's see. So hang your fluid up, have your tubing here. Take this piece off. Try not to touch the area here. Even though it doesn't need to be sterile, it needs to be clean, but this needs to stay really clean. So you're going to kind of like a twist motion, pushing in, carefully not to puncture the side of it. Going all the way in. Okay. We're going to just put it here. Do a few squeezes here to fill up this. Okay. Now we need to get all the air out of the lines, okay? Make sure, again, do not let this touch anywhere that's contaminated or dirty. It's going to go into the patient's IV, so we need to make sure that this stays clean at all times. So in order to prime this tube, you need to open the valve up here, okay? Open it up and have a trash can for it to flow through. And I don't know if you can see in the video, bubbles, air bubbles in the line is coming out. So you got to make sure that all the air is out. Okay. Now, the same piece that you kept earlier clean, just kind of put it back on here, okay? You're going to drape this right over, making sure that it's clean, okay? Now, we're going to put an IV into the patient's. I'm going to try in the arm here. And so when I walk in, introduce myself, do my, make sure it's the right patient, verifying his date of birth, his name by his armband, and then tell him what's going on, that we need to get an IV in him, and that we possibly, whatever the reason being, whether it be fluids or antibiotics, whatever the cause is going to be, he needs an IV. So start off, I'm going to assess his arm or his hand. Like I said earlier, identify which one I want to insert the catheter or the needle into. And so I'm going to do one right here in the hand. So now that I inspected it, I wash my hands. I have clean gloves on. So in the video, I have clean gloves on. My hands are washed. I identified the patient. So now we're going to put these tourniquet on. So we're going to pull it here. I don't know if you can see in the video. We're going to pull, and we're just going to drop it right underneath. And it's going to hold pressure. It's going to allow the vein to get bigger. At this point, now that there's pressure on your patient's arm, you want to act quickly. Okay, so let's see if I can come down just a little more so you can see it better. There we go. This here, we're going to clean the area. We're going to go right here. So whether you can crack it, I don't know if you heard that pop noise, crack it. Take this here, and we're going to clean the area for like a circle out. Okay, cleaning the area, air drying. Now we're going to insert a 22 gauge needle. That's what we have. Okay. Now, sometimes we have one with safety features where you click the button and it comes out. This one doesn't have that, so it's going to have to hold it and pull it completely out. All right. So once bevel up, go in like right here. Let's see. It's been a little stick. Always educate your patient what's going on. All right. And then once you get a little flashback, you know that you're in the vein and you shouldn't go any further with the needle. So holding the vein so it doesn't roll, thread your catheter in. Okay. Thread your catheter in and hold pressure. And then almost you click the safety feature at this moment and it's going to pull the needle back in. This one doesn't have a safety feature. So we're going to take this and we're going to dispose in the sharps. So holding pressure that the blood doesn't come back out, you can see that the catheter is in the vein and here. I would usually have a piece, an adapter that connects to this where I can hook up my saline. However, we don't have that for the purpose of the video, so I'm going to show you how to fasten it for what we do have. So it's connected. I'm going to go and I'm going to put this underneath here, and it's going to be like a Y, or like a ribbon, like a breast cancer ribbon, just crossing it. Okay, now that my adapter's hooked up, I have my flush hooked up to it as well. So once it's in, I have the piece that connects here to the flush. We're going to flush it to make sure it's patent. Okay, flush it, and then you have this here. So it's all fine. You're going to tape it around, kind of come to the side where it's coming up. You don't want this dangling your patient's fingers and caught on something, rip it out. Have it up. This here, this bandage, I'm going to come up and go completely over it. Okay, come straight on, showing that it's tight to the patient's hand, and then peeling all the way around. Okay, it's all the way around. This is a really important step. Make sure that you date the your IVs, because they need to be replaced per your facility policy, and you want to undo this as well. You need to date it, really important, because you don't know how long you walk in a patient's room and it's just been sitting there, and it could have been in a week when it should have been replaced. Most places say 72 hours, or again, like I said, your facility's protocol. So again, date it and put your initials. And now, after, say I have the half block hanging out, I want to assess it. I want to make sure that there's no redness, no swelling, or nothing like that. That it's like the vein didn't blow, or so. After this next step, we're gonna move. So just slow down. This is secured. Everything is fine. We have the saline lock coming out the top. Now, this step earlier, we prepared the tubing and the 500 milliliters of normal saline. We come here, have your alcohol. This is going to be, for the purpose of the video, this is going to be my alcohol. You make sure and you clean the edge of the lock, and here, okay? So, I mean, obviously you take this off, and then you connect it, you screw it in together. And making sure that you never touch the inside, because it's going to go, in theory, in the patient. So have it in like this, making sure that, again, initially you primed and made sure that there's no air bubbles inside the line. Let's see. So now that you've hooked it up initially, now in say 72 hours you come through, so it's still, you're going to replace this here for your facility policy. You're going to probably replace this. Okay, now you come in and you say, okay, I need to change these out. It's expired. So you come in and you do the same exact thing. You change your lining out. So new bag, get you a new prime tube. Making sure it's not a secondary tube, because you got to make sure that you have the right equipment to get the job done. So you basically just pierce the bag again and making sure these are clean. Hook it back up like we initially said. That is to change it out at the right time, 72 hours later. Sometimes they order just to have it like saline locked. Saline locked is basically you come in and your saline is just a little connector. It's hanging out to the top. You flush it, and there's nothing hooked up to the patient, whether it be IV bolus or whether it be normal saline or whatever fluid that's running. There won't be anything running. It'll just be there in case you need it. Let's see. Throughout this whole deal, you want to make sure that you document the patient, that the patient didn't have any sort of reaction to or pain and discomfort, redness, swelling, tenderness. Make sure that the catheter is indeed in the vein, not in the, say, another space. So let's see. I would document that this is a 22 gauge needle. You make sure, again, reiterating that it is important to have the dates on the bandage so the next nurse can know when it was changed exactly, making sure that you have your dates, your initials, and documenting in the chart whether it's a lock or it's continuous, depending on what the physician orders. And that is all to IV therapy, and I will do another video containing blood cultures and safe IV medication administration. Thank you so much, and I appreciate it.